The head of pulmonology at the Max Super Speciality Hospital. Dr. Nangia, how bad was it from a health perspective today? In comparison with the last few days, have you seen a sudden spike in the number of patients coming over to your hospital seeking treatment?
Actually, it'll be too premature for me to say something like that. That, in just one day's elevation in the AQI levels, worsening of the AQI levels, there has been a sudden rise in the number of cases coming to the hospital. But yeah, certainly, if I compare it to the last year when we were in a practically a lockdown kind of a situation, staying indoors as much as possible, wearing masks at all times, the number of cases of people coming in with respiratory allergies, asthma, cold, flu were definitely much lesser then as compared to this year now. In the last 1 week, 10 days or so, we've been seeing a persistent, constant rise in the number of cases. Even if it is in terms of 5 or 10%, but yeah, there is people who are complaining of cold, burning in the eyes, running nose, stuffy nose, sore throat, breathing difficulties, breathlessness. So those are the common symptoms that people are coming to us these days with.
Jyoti Pandey Lavakare, it seemed for a while that the No Firecrackers campaign was winning the battle for narratives. Now there seems to be a pushback from the likes of Mohandas Pai, from the likes of Rahul Ishwar, from many in the BJP, who are saying that this is about Hindu culture, this is about Hindu history, this is about our right to burst firecrackers, and nothing that the likes of Raghav Chadha, Vimlendu Jha and the others can say will deter us from going out and bursting firecrackers, and we are willing to live with the consequences of our decision.
This is not at all about anything apart from public health. Every research shows that any sort of air pollution causes health harm, serious health harm. I'm not just talking about upper respiratory tract colds and coughs. It causes lung cancer. It can cause all sorts of cancers. It can cause strokes, diabetes. We know all of that. My point is simple. There has been a colossal breakdown of enforcement, so of the executive, of legislature, and of course the politicians who will only fight amongst each other. We have the Prime Minister, who is not just the head of, who's not just the leader of the BJP, but also the Prime Minister of the entire country. I think the onus should have been on him to say, it's not just Delhi that's suffering, it's Uttar Pradesh, it's Haryana, it's the entire Indo-Gangetic plain, which has almost half a billion people who are suffering from all sorts of health harm because of air pollution. This is not just a seasonal problem. It is a problem that happens through the year. And it happens not just at low levels. It is there at high levels through the year. At this point, it peaks to alarming levels. So I think if the government can, whether it's state government or central government, if they can have a lockdown, which was serious, if they can fine people for wearing, for not wearing masks during COVID, if they can have that kind of, every phone call you made was talking about COVID. I think if the intention was serious and if they really wanted to make sure that human health was not harmed by air pollution, which includes firecrackers, which includes stubble burning, which includes thermal power plants, which includes many other things, including garbage burning. So there are a whole host of problems, and all of those need to be handled. And that has not been done. And this fighting between BJP and Congress and Aam Aadmi Party is actually very disturbing, because none of them care about the lungs of the Delhi citizens and the entire Indo-Gangetic plain, people who live in the entire Indo-Gangetic plain. This is not just a Delhi problem. Let's not make it a Delhi problem or a religious problem.
Which is why I've been referring to North India.